Hi, my name is Dr. Rudramohan, and through the Oral Health channel today we're going to be talking about how to choose your dentist. Let's start. So today's episode is going to be very interesting, and I am making this out of sheer social responsibility towards my patients. A lot of patients have commented in the comment section as to where to find genuine dentists. We can't find genuine dentists. There's a lot of generalization when it comes to the fact that there is an image of dentists as money makers, and the fact that they are very money minded and materialistic, and they don't really don't give much of a damn towards the patient's overall health and welfare. So I thought it's better that I make an episode, and I've done my back-end scientific literature research about it, and there are some commonalities that I have seen, and thankfully they are also ingrained. Those qualities for a dentist, for an ideal dentist, are actually ingrained in me. So I feel very blessed by the blessings of my educators, the blessings of my teachers, my professors, and also my family members and all my elders who have showered all the blessings on me. So now, depending upon what your age is, what your gender is, what your location is, there are a lot of factors to be considered how to choose a dentist. Let me talk about the main example when it comes to the age, the criteria. So depending upon your age, you are either technologically savvy or you are not very much adamant on using technology in 2024. For senior citizens, it's important to know that you need to be recommended a good dentist with someone that you know. The literature itself says that if you are recommended a dentist by someone you know, that person's opinion is much more rate-worthy than anything that is online or social media or advertisements or just you asking around. So it is very important that if someone close to you, that whose opinion you hold of value, and they recommend a dentist to you, it makes more sense, and then you would go on the personal experience. That is something known as word of mouth, which is still the golden standard when it comes to advertising your clinic, advertising your practice, advertising your profession and your work and your branding. Now, coming to the fact that if you are technologically savvy, right? So you have something known as online Google reviews. How to go about a Google review, it's very important. You need to understand that it's not just the number of reviews, because that can also be bought. It's not when you write best dentist near me, that can also be bought. What you need to really search for is the maximum number of 5-star views, or 4-star also, but 5-star would be recommended, and least number of 1-star views. Now once you have that, when it's not a mixed bag, it's more of the skewed on that side, and you have to go through the review to see what it is all about. Once you go through a review, if it's elaborate, it is extensive, where the person has talked about their life or their journey during the dental experience, what was the chief oral complaint that causing them discomfort, and how the dentist reacted with them, how it was communicated to them with transparency, and how it was cost effective or it was managed through whatever it was, and how the total experience was. So try to go for searching for reviews, and believe you me, I did not understand this myself unless this the so-called snowballing effect started. So this is very important. Read the reviews, try to understand what it is, and they can talk about the clinic ambience, they can talk about so many other things. Now once you've gotten that, what you need to do is, the next step is to find out the location. The location should be as near to you as possible. However, when you know that the dentist is competent, the location actually doesn't matter. I'm not trying to toot my own horn, but we have patients who are international clients who fly down for treatment because they feel that I am competent enough to get the things done. So the distance does not matter as long as the dentist is competent. That's the most important thing. So you have that, and then after that you have to see other things. How is the clinic facility, where it is located, what floor it is located upon, if there is wheelchair accessibility. This is for geriatric patients, the older patients. Even if there is an elevator that is functioning, the fact that a clinic is on the 3rd floor or a 4th floor or 5th floor, whatever floor, patients tend to have some sort of dental anxiety when it comes to geriatric patients. They don't want to, because they feel like that they have to walk and stay in the elevator. So make sure that you can try to choose, as per your convenience, something that is convenient for you. Now once you've entered the dental office, it also depends upon the surroundings. You have two places. You have the operatory and the waiting room usually, and the waiting room also dictates a lot of things. The waiting room dictates as to what kind of ambience you want to create, if there's background music. Now that doesn't happen much with the older patients as per studies. For the younger generation, background music does matter. The feel of the place, the modernization of the waiting room also makes a lot of difference. As you age, that's what the literature says, the amount of literature in front of you doesn't matter so much, because the main thing that matters is that you should have a very short waiting time, usually not more than 10 to 15 minutes, absolutely, which we also follow in our practice. This staff, the auxiliary staff that is there at the front desk or otherwise, should be as supportive and empathetic towards you. They should ask you for water, they should ask you how you're doing, and be very warm and gentle with you. Once you've met the dentist, it is very important. The biggest thing apart from the competency is that the dentist has an empathetic ear. He or she hears you out completely. You tell whatever you're going through, whatever oral health problem you're going through, pain, discomfort that you're going through, and they keep an ear out, trying to find out clues and cues about your personality, your outlooks towards a lot of things, your outlook towards pain, your outlook towards the financial aspect of dental treatment, your outlook towards oral health awareness. And these are the things that a good dentist will definitely catch upon. They will also want to talk to you about your families, your business, what you do, because a lot of things in the oral health are related to your occupation. So that's where a genuine dentist will definitely keep an eye out to have a conversation with you. And then obviously once the problems have been told by you to the dentist will do the examination and the x-rays, tell you what the problem is, tell you the solutions of the problems as well. The most important, the solution being the problem should be rectified. That is the main thing. The chief complaint, the complaint that you came with should be rectified, and if you're in pain, it should be taken care of. If you have a swelling, it should be taken care of. So many other things that should be the priority of the dentist, and not other ways, beating around the bush that you get this also done, you get this also done, you get this discount. No, that's not how a genuine dentist works. The chief complaint has to be addressed first. Now, once that thing is done, you are obviously entitled to ask about different alternatives when it comes to the cost, when it comes to the quality. Obviously, a genuine dentist will first take care of the problem and then talk about the best quality, and then you have other things. If the socio-economic situation might not be in your favor, the financial situation might not be in your favor, they might be more reasonable rather than cheap, or cheaper, reasonable alternatives that the patient can be told about by the dentist, and the possible risks or possible sequelae that you might get, in cases if you're going for a cheaper option, that you might not get the great quality, you might not get the same satisfactory result. So these things have to be told with a lot of transparency, and once you have agreed upon the thing, now one more thing that I would like to talk to you about. I personally am not in favor of discounts. And when you ask a dentist for a discount, especially in the Indian demographic, I don't know about the rest of the people, I feel a little offended. It's just how I practice. I have a multi-speciality practice where specialist consultants come in. The discounts that are provided by dentists are actually their sense of entitlement, that we feel that we are entitled to provide you discounts with. Right? We will cut back wherever we can probably cut back to give you discounts, so that you also feel it's alright. It doesn't tug at your purse strings too much. But I would strongly recommend that if a standard protocol of sterilization of SOPs of the clinic, or the protocols are being followed, the materials are of very top-notch quality, it always comes at a price which is slightly higher than the normal norm, because of the fact that people believe in disruptive marketing, and it is just a short-term gain. I'm being very candid about, and if any dentist is going to watch it, hate me as you might, it's absolutely true. If you're trying to disrupt the market by slashing around the prices, it's not going to work. It's going to work for maybe 2-3 months, maybe a year, and then you're going to start suffering yourself. So I would rather, honestly, from a dentist point of view, I would rather say no to a patient who wants to slash the prices too much and not provide them. I would provide them the great quality, but I won't feel very inclined towards that kind of this thing. So I would say no. I say no to a lot of patients because of the fact that these are the charges, the standard charges apply, and there is very less room for discount. So after all this thing is done, whatever procedure is done, the follow-up is very important. Make sure that the dentist, whomever you're choosing, and you can really understand how invested the dentist is in you. If it's a follow-up of an extraction, the telephonic follow-up has to be taken. If it's even anything else, even if it's not possible for a telephonic follow-up, you need to take a follow-up on message or WhatsApp, so that we know, as patients, we know that the doctor is caring for us. That is very important. right? And that's where the build of the trust actually happens, that the doctor actually cares about your well-being and he or she is taking care of you even after you've left the clinical premises. And that's where the trust is built, and the trust is actually it's a very fragile thread. It can break, and anytime you try to mend it, after breaking it will always have a knot. So that's something that you need to really understand. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling me directly, as I might be busy with patients. Just drop me a message on WhatsApp with your name, your location, and the common oral health problem that's giving you discomfort. I'll reply to you within a couple of days, and then we can have a chat. If you have any queries, doubts, apprehensions, insights, please feel free to put them in the YouTube comment section. So that's it for today. Thank you.